Have you ever wondered what exactly happens during those 9 months of pregnancy? It's a miraculous journey, filled with tremendous changes and growth. From the first flutter of life to the final countdown, pregnancy is a whirlwind of anticipation and preparation. Today, we're going to shed some light on this fascinating process, exploring 10 key things that everyone should know about pregnancy. We'll cover everything from the trimesters to the diet, emotional changes, and even life after pregnancy. So stay tuned as we delve deeper into this fascinating journey of life creation. The first trimester is a period of rapid development. During these initial 12 weeks, your little one undergoes an incredible transformation. From a tiny cluster of cells, the baby takes on a human form, with the formation of major organs like the heart, lungs, and brain. It's an exciting, albeit invisible, evolution happening right inside the womb. Now let's talk about what's happening with the mother. The first trimester is often marked by a surge in hormones. This change gears up her body to support the growing fetus and can bring about some noticeable changes. You may experience heightened emotions, increased urination, and yes, the often talked about morning sickness. Fatigue is also common as your body works overtime to create a nurturing environment for your baby. Despite the mother's possible morning sickness and fatigue, the first trimester marks an exciting start to the pregnancy journey. It's a time of anticipation, changes, and the beginning of a new life chapter. The second trimester often brings a wave of relief for many expectant mothers. It's like seeing the light at the end of a tunnel as morning sickness often eases up, giving way to a renewed appetite and a sense of normalcy. At this stage, the baby is growing rapidly, developing features and even starting to kick, adding a fascinating dimension to this journey. The mother's body is also changing, adapting to accommodate the growing life within. The baby bump becomes more noticeable, and there may be changes in skin pigmentation. Some mothers also start to feel more energetic, a welcome change after the fatigue of the first trimester. However, it's not all sunshine and roses. There may be new discomforts like backaches and leg cramps, but these are all signs of the body preparing itself for the grand finale, childbirth. This period is often considered the golden period of pregnancy. The third trimester is a time of anticipation and preparation. You're nearing the end of this incredible journey, and your baby is putting on the final touches. Their bones are hardening, and their tiny lungs are practicing for their first breath. Your baby is growing stronger every day, gearing up for their grand entrance into the world. Meanwhile, you're likely preparing your home and your life for the arrival of this new family member. You might be nesting, tidying, and organizing, or attending childbirth classes. There's a lot to do, but remember, it's okay to ask for help and take breaks when you need to. The third trimester isn't without its discomforts. You might experience backaches, swelling, and difficulty sleeping. These are all normal parts of pregnancy, but don't hesitate to speak with your healthcare provider if you're concerned. As the due date approaches, the excitement and anticipation build. You're almost there, and each day brings you closer to meeting your baby. A healthy diet is crucial during pregnancy. It's not just about eating more, but eating right. Your body needs an array of essential nutrients to support the growth of your little one. Protein, for instance, is a building block for your baby's cells. Go for lean sources like poultry, fish, beans, and tofu. Iron and folic acid are also vital to prevent anemia and support neural development. You can find these in leafy greens, fortified cereals, and lean meats. Calcium is important for your baby's bone development. Dairy products, fortified plant milks, and dark leafy greens are great sources. Fruits and vegetables, of course, are your go-to for vitamins and fiber. But let's not forget, some foods are off the menu. Raw or undercooked meats, unpasteurized dairy, and high-mercury fish pose risks, so they're best avoided. And finally, stay hydrated. Water plays a key role in delivering nutrients to your baby. Remember, you're eating for two now, so make every bite count. Exercise during pregnancy can be beneficial for both mother and baby. It can help manage weight gain, improve mood, and even prepare the body for labor. Plus, it's a great way to bond with your little one before they've even arrived. There are different types of exercises suitable for each trimester. During the first trimester, low-impact exercises like swimming or walking are excellent choices. As you progress into the second trimester, prenatal yoga or Pilates could be a fantastic way to stay active and flexible. And in the third trimester, gentle stretching and pelvic floor exercises can keep you feeling strong and ready for labor. However, it's important to remember that every pregnancy is unique. What works for one might not work for another. So always consult your healthcare provider before beginning or changing an exercise regimen. They can provide advice tailored to your specific needs and circumstances. Exercise can make your journey through pregnancy smoother, so why not give it a try? Regular prenatal checkups are essential for monitoring the health of both mother and baby. Let's dive into why that is. Prenatal visits are designed to ensure that pregnancy is progressing healthily, catching potential complications before they become serious issues. It's a time for healthcare providers to assess the well-being of the mother and the developing baby. During these visits, expectant mothers may undergo various tests, from blood pressure measurements to ultrasounds, and even glucose screenings. Each of these is crucial in its own way, providing valuable insights into the health status of both parties involved. The advice given by healthcare providers during these visits is equally vital. Based on their assessments, they may recommend dietary changes, exercises, or even bed rest. Following these recommendations can significantly improve the chances of a healthy pregnancy and safe delivery. So, whether it's your first pregnancy or your fifth, remember, each prenatal visit is a step towards ensuring a happy, healthy journey into motherhood. Never underestimate the importance of regular checkups. A pregnancy can be an emotional roller coaster. It's a journey filled with joy, anticipation, and yes, sometimes a fair share of anxiety. Hormonal changes that come with pregnancy can significantly affect your mood. The surge of hormones can make you feel unusually emotional or reactive, and that's perfectly normal. Managing stress during pregnancy is important for both you and your baby. Simple strategies can be as effective as taking a warm bath, practicing mindfulness or yoga, or even indulging in your favorite hobby. It's about finding what works for you and making time for it. Emotional support during pregnancy is paramount. Your partner, family, friends, or even a support group can provide a safe space to express your feelings and fears. You're not alone in this journey, and it's okay to lean on others. And finally, remember, it's okay to seek help if you're feeling overwhelmed. There are professionals who specialize in maternal mental health, and they're ready to assist you. Pregnancy is a journey, and you don't have to walk it alone. Preparation can make the process of labor and delivery less daunting. It all starts with understanding your birthing options. Whether you opt for a hospital birth, a birthing center, or a home birth, each has its own set of benefits and considerations. It's about finding what feels right for you. Next, know the signs of labor. Early labor may feel like backache or cramps, and you may notice a bloody show. As labor progresses, contractions become stronger, last longer, and get closer together. Remember, every woman's experience is unique. Creating a birth plan is crucial. It's a document that lets your care team know your preferences for things like pain management, delivery positions, and who you want present. But be flexible, as circumstances can change. Finally, remember to pack a hospital bag ahead of time with essentials like clothes for you and the baby, toiletries, and snacks. Knowing what to expect can help ease any anxieties about labor and delivery. Life after pregnancy can be a mix of joy and challenges. You've just gone through an incredible journey, and now you're entering a new chapter. The physical recovery after birth might be more of a marathon than a sprint. Every woman's body is unique, and each heals at its own pace. You might feel a little sore, you may experience hair loss, and your body will take time to return to its pre-pregnancy state. The emotional changes can also be quite significant. From the joy and love you feel for your newborn, to the overwhelming responsibility and occasional bouts of baby blues, it's a roller coaster of emotions. But then there's the unparalleled joy of caring for your newborn. The first smile, the first word, the first step. These milestones are the moments that make the sleepless nights and endless diaper changes worth it. Despite the challenges, the arrival of your little one makes it all worthwhile. Pregnancy is truly a unique journey. It's a roller coaster ride filled with physical changes and emotional shifts, but it's also a time of anticipation and preparation. From understanding the stages of pregnancy, to maintaining a healthy diet and staying active, to scheduling regular prenatal checkups, every step is crucial. And let's not forget the emotional roller coaster and preparing for labor. After all, this journey is leading to a remarkable destination, welcoming a new life. Remember, every pregnancy is different, and this beautiful journey paves the way for the miracle of life.